So, good morning, everybody. And to all the essential employees out there doing your job, thank you as always. To everyone out there doing the right thing, thank you. To the residents that have been listening to Dr. Whalen and I, thank you, thank you, thank you. And I'm going to get into a little bit of that, but one thing, I don't want to jinx us. This is 7 days without someone passing, and that's great news. It's great for people with loved ones, but most importantly for us, that keeps us up at night worrying about this. So we are starting to go in the right direction on a lot of things, but we can't continue to go in the right direction without your help and without you continue to do the right thing, wearing your mask in public. We've gotten a lot of complaints about our rail trail, people not wearing masks or people going into stores. Look, it's not the law, but you should. You should wear your mask when you go into a store, and not just for you, for the courtesy of people around you and for the workers that have to come in to work every day to pay their bills, to put food on the table for their families. Think of the workers. If you don't want to think about anyone else, think about the people that are in there. But as of today, there's 1,644 positive cases, and it's up 5 from yesterday, which is good news. 845 people under mandatory quarantine, that's down by 14 from yesterday. 7 people under precautionary quarantine, that's up by 2 from yesterday. So a total of 5 new cases today, which is great news. We have 4,451 people have completed quarantine. That's down 73 from yesterday. Out of that, we have 1,237 that tested positive for the virus, and we have 37 recovering since yesterday, which is also great news. Some great news too, because we've said this before in the control room meetings I have every day at 1400. One of the things they have emphasized and they continue to look at is hospitalization rates, ICU rates, beds available just in case this blows back up, that we have enough hospital beds. So as of today, we have 27 people hospitalized. That's down 6 from yesterday, which is good. With a hospitalization rate of 1.64% of those who have tested positive, and yesterday the rate was at 2.01, so it's good stuff. Unfortunately, we still have 3 people that are currently in ICU, same number as yesterday. But again, it's going in the right direction, and one of the things, and I think Dr. Whalen pointed it out better than I do, being a doctor, you have elective surgeries going on, so you do have people that go in for a couple hours or they stay the night because of elective surgeries that they have going on. So we had to take that into account with the control rooms. But over the last 5 days, it's been an average of 5 new positive cases each day, which is great because before I announced it was 12.2, and 5 days before that was at 17. So which is all good stuff too. When we saw the spike happen, and to answer some of the questions we were getting from Facebook and email, was the fact of, the nursing homes now are online. We're testing, other nursing homes. We've been doing it since the beginning, but other nursing home now, so mandated through the executive order to test their employees twice a week. And all the residents had to be tested. So we were waiting for that to change a little bit. I also want to remind everyone, this is 78 days into it since we announced our first case, and we're going to hit the 12th week on Friday. So yeah, again, it's a marathon, not a sprint. And I keep reminding everyone, it's not over with. It didn't go away just because our numbers are good. It means everyone's doing what they need. And one of the things that Dr. Whalen pointed out and that we're looking at, it takes 14 days, you were saying, for this to show up. So this weekend's going to determine a lot of what happens in phase 2, because even though we get to phase 2 by June 3rd and everything's going in the right direction, what you did this weekend could affect that. And if you go from, I think Friday would be June 6th, and if you go from Monday, it would be June 10th before we fully see the impact from this weekend. And I hope everyone did the right thing and listened. So as we continue to aggressively test, please go to our mobile test sites, as always, and the number is 518-465-4771, area code 518-465-4771. Essential workers and people going through the drive-through, you can go to Albany, you can do it online, or you can call always at 1-888-364-3065. And our colony testing site, Rite Aid, as always, riteaid.com, and our great partner in Gilliland, Priority 1 Urgent Care. Please, you can go there too and do both. So I want to talk a little bit about, reopening, getting into phase 2. We're still waiting on guidance from the control room on a variety of stuff, but I'm going to go over a little bit on the dashboard tracker, but and Dr. Whalen will take it from there. But as we get into phase 2, reopening, we got to make sure we're heading in the right direction. And like I said, that starts June 3rd as we continue to go forward, and everything looks great in the capital region that we're lumped into with everybody. So it's going to be good. Phase 2 will include professional services, because we got this question, and we'll address it more as we get to it. Additional retail, administrative support, real estate, along with rental and leasing services, real estate, all that stuff. And from the business owners that are included in phase 2 should also include things like salons, barbershops, and more. And we're still waiting on guidance for a lot of these different stuff that's going to be opened up. And as you know, he moved salons and barbershops from phase 4, I think it was, to phase 2. And then he changed the camping too. So you're going to see some of that based on the statistics around the state, how things are going as he phases in, the governor phases in the reopening. You'll see things change. You'll probably see things from phase 3 to go to phase 2. And, we'll address that as we go forward. But I'm going to bring you to the smart board and bring you to the bottom of the page. And just over a week ago, we roughly tested 17,200 Albany County residents, and that was 9.2% of them had tested positive. And as of May 25th, we've tested 22,000 residents, but I'm going to bring it over there and get to the bottom here. The one thing I want to show everybody. So as of today, we tested 22,032. Who tested positive out of that was 1,793 as a positive result of 8.10%. And that's 328 people today in new positives today too. And Dr. Whalen will get into the other stuff because she's much better at all the tracking on this. But the other thing that we've been following, the 20 to 29-year-olds, and you can see that number continues to grow. And there you go, 270 cases between 20 and 29, and if you look at the other one, 284 between 50 and 59. And that's what we're stressing to the younger generation. I know you don't want to hear it. I know parents don't want to hear it. I'm not trying to scare them. I got 2 kids that fall in that category between 20 and 29, and I emphasize to them, you're the ones that have no symptoms, and you're the ones that are, exposing other people. So you need to wear a mask. Wear a mask out in public. And the other thing as we go forward is if you see, we peaked up here, but we really peaked up and we're going down, which is all good news for us. But if you watch the diagram here, we're still kind of steady here and we're waiting for that to start to come down. So we're getting there as we go forward. But again, we need everyone out there to continue to do the right stuff and continue to wear your mask. And that 20, 29-year-old, I'm picking on you. So I'm going to look at all of you. I'm picking on you. Please, by all means, you're the ones that are, you're healthy, you're going out there, you don't have signs and symptoms. Just do the right thing. Throw a mask on. You want to go out and do it? Just throw a mask on. Continue to do the right stuff. And we'll continue to open up and get past this together in a partnership. Dr. Whalen.
Thanks, Kenny. Executive McCoy. So I think the numbers look very encouraging. We are seeing many less cases on a daily basis. As all of you will recall, about 2 weeks ago, we were seeing sometimes 30 to 40 cases a day being reported, and now we're down into the single digits. So this is very encouraging, and hopefully is a trend that will continue to drop off. This is the epi curve. So this is really the curve that we are seeing trend down over time. This is from the 12th of March until the 25th of May. And we do see us peaking around the end of April. That date right here with the most cases was the 24th of April. And then we started to trend down. So this is, as you see, almost as low as it was in the beginning. So we're going to keep an eye on that, and hopefully that continues to trend down. In terms of geographic spread, we continue to see our highest numbers focused around the city of Albany, with 12203 being our highest zip code, followed by all the areas right around Albany City, which have cases in their hundreds as well. We talked about the age distribution, which remains consistent across time. So it's important for those in those particular demographics, 20 to 29 and 50 to 59, to be aware of the fact that they're showing the highest number of positive cases. We continue to see the cases split between the sexes for the preponderance of hospitalizations being in current hospitalizations, male more than female, but ever hospitalized, it's a breakdown 50-50. Again, when we look at the age groups of those that have died and those that have been in the ICU, we see higher rates for those over the age of 50. And we continue to see, if we look at racial demographics, that if we look at our county demographics, there still continues to be a disproportionate burden of higher levels among Black or African American populations for hospitalizations and ICU, and the deaths not as high as in terms of disparity, but we are seeing higher levels of hospitalizations in ICU. So when we look at the COVID tracker for the New York State Department of Health, the important information on this when we look at the trends for Albany County is we are seeing, not only are we seeing decreased numbers of cases, which is the yellow shaded area, but we're seeing a lot less testing go on. So these blue shaded areas are the numbers of tests that are done on a daily basis. And as you see, we're continuing to see low numbers of people being tested. So what I wanted to show people today, hopefully, it worked on my computer. If we go back to, I don't think I can get to the New York State Department of Health website from here. I thought I could. But what I wanted to share with people is if they go into the New York State Department of Health website, there are numerous resources that people can utilize. These resources include guidances for business, workplace, schools, etc., to try to prepare for the eventuality of people coming back to work. And I would encourage people to look at that, and I'd also encourage people to look at the testing criteria. Again, we talked about people who are asymptomatic, may have COVID, and that it's important to be able to recognize this so we can contain it. So those phase 1 workers and those preparing for phase 2 can look at the criteria for testing that are available on the State Health Department website. Also, there is a locator to find where the nearest test site is to you. Testing is widely available in Albany County. We have that as a great benefit that we've had since the beginning. So I would encourage those that want to get tested to look at that website and avail yourself of testing. And for those of you that are going back, look to see how you can educate yourself so that when you go back to work, when you're entering into your workplace, you understand the best way to control the environment that you work in so that you can decrease your risk of contraction of COVID-19 and make the workplace safer. All of us are hoping to get back, but it has to be different than it was before if we are to continue to move forward with the progression of reopening. We need to stay mindful of the guidances of how we space out at work, what the work environment looks like, whether employers decide to either stagger schedules or have people work from home and work from the office. These are considerations that are being undertaken at the county level as well. So this is the time to really start doing this and to prepare so that we can continue to see these downward trends. And so that we can also prepare ourselves for the possible eventuality of a resurgence.
Thank you, Dr. Whalen. And you're correct. As we reimagine what the workforce is going to look like and how we're going to open up, I say to all the news that's out there, 610, 13, YNN, 1300, things are different. Times Union paper is different, right? It's all online, Altamont Enterprise. It's different. People are doing Zoom, they're doing video on Facebook, they're giving briefings that way. We're being creative, and that's what's great about the Capital District. We have to continue to be creative as we start to reopen up. But please, the reason why I talk about the mask, and I said this early on, We're getting a lot of people complaining about that they're out in public and people don't have their mask on. Yes, you don't have to wear a mask if you're 6 feet apart, but if you're on a rail trail or you're walking down a crowded street, you should have something on when you walk past people, just as a courtesy. But we'll continue to address that. Also, as always, and I put this out there and we put this on our Facebook, so the one question everyone keeps asking, who do I call, who do I call? So there is a number you can call for enforcement of any state reopening guidelines that you feel are being violated if you have a complaint, but it's 1-833-789-0470, 1-833-789-0470, or go to the state website and you can locate it on the slide that we'll post later on Facebook, which is, a good way of doing it. And again, we've said this before, the enforcement is you. It's the workers and it's the consumers that are doing business with these businesses, or you see something not happening at a certain grocery store you go to or corner store you go to. We're relying on you for enforcement. Also, some of the good news to share, we've been working with ASM, which runs our Times Union Center, and we've been working with high schools and colleges to have a plan for graduation. And we submit that plan to the control room, and we're waiting for guidance. Also, we submitted plans for the drive-in movie theaters to do this, and if I've gotten numerous phone calls from superintendents and presidents of universities that want to take us up on the Times Union Center or want to do it at the drive-ins or want to do the football field. They're good to go until they're good. The plans that we submitted for safety are good to go. We're just waiting from guidance from the control room to say yay or nay. And I know that it's, times of the essence. I know we're getting to that point with graduations with school. That's the best I can tell you, is that we're just waiting for the green light to have it. The drive-ins, that's one of the things I've talked to Dr. Whalen about. I don't understand why we can't do the drive-ins, because it's social distancing and it really works. And the plan that ASM put together for our Times Union Center works. We figured it all out. Bob Belber did a good job. And we just want to be able to give these kids some type of normalcy and enjoy their senior year, be it high school or college. It's an achievement. And we shouldn't rob them of that achievement. They're always going to remember how they spent their senior year, but let's just give them that. They worked hard for 4 years, and a lot of parents would love to see their kids walk across some type of stage, even though it's going to be different, and it's going to be social distance, and everyone's going to be more than 6 feet apart, and you're probably not going to be shaking hands, just getting your diploma and keep walking. There were great plans this school's put forward, and hopefully the state gives us the green light on that sooner than later. But that's one thing we've been trying to address on these daily briefings at 2 o'clock that I have. And again, as always, mental health support is available. We're going to probably have Dr. Giordano back on sometime this week. He's been fielding a lot of questions, and it's a great update for everybody. But again, it's available 7 days a week, 8 a.m. to 8 p.m. The number, as always, is 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716. And as always, our partnership with the 211 number in the New York State hotline. Again, thank you to everybody for doing what you need to do to keep us opening and getting us into phase 2.